This work is about follicular lymphoma. We screened a large population of follicular lymphoma patients enrolled in the Fondazione Italiana Linfomi FOLL12 trial to find new molecular markers for MRD detection. Usually, follicular lymphoma is monitored for minimal residual disease by using the BCL2 IGH rearrangement with the conventional PCR, nested PCR or real-time PCR. By these classical methods, only about 50 to 60% of patients could be monitored because the primers, most used primers, are able to target only one of the rearrangements, the MBR rearrangements. So in this trial, we enrolled about 800 patients, and about 40% of these patients cannot be followed for MRD with conventional PCR. Therefore, we analyzed the bone marrow aspirates of these patients without a molecular marker with two different NGS approaches. The first is targeting immunoglobulin heavy chain rearrangement, and we use the EuroMRD NGS published approach using FR2 primers. We screened 120 patients without a molecular marker, and we were able, with this new approach, to find a molecular marker based on immunoglobulin on 56% of patients, 63 out of 111 evaluable patients. Then we used an alternative method based on TLA, targeted locus amplification. It is a novel NGS technique targeting not the immunoglobulin rearrangement, but the BCL2 immunoglobulin rearrangements. With this novel technique that we recently published, we tested an initial series of 15 patients without a molecular marker, and we were able to identify a new BCL2 translocation in 8 out of 15, so about the 50% of patients. And what is most interesting is that the two used techniques are not exclusive. So we were able to identify IGH rearrangements also in patients in which TLA failed, and vice versa. Then we started to use this new rearrangement to follow MRD. As a proof of principle, we were able to design patient-specific primers on these new rearrangements, and we were able to build up MRD assay, real-time PCR MRD assay with high sensitivity. So this is in this poster, it is presented only the first step, this marker screening approach. The second step will be to follow with MRD by NGS, also to follow the MRD on the follow-up samples of these patients to see whether it is possible to obtain and to use available and feasible new molecular markers for MRD detection in follicular lymphoma without a classical MRD marker.